Hi, everyone. How are we doing?
Good.
Good,
Good.
good. Fantastic. All right, so I think we're going to get started. I'd like to start off by welcoming everyone to the End the Discrimination Blood Ban panel discussion. We have some really fantastic speakers today who are going to be part of this discussion and answer many questions regarding the blood ban. But before we get into all of that, I'm going to introduce myself. We're going to do a little housekeeping, and then we get into it, okay? So first off, my name is Sebastian Lalonde, or Sebastien Lalonde. I am a Franco-Ontarian queer youth living in Toronto. My pronouns are he and him. And yeah, I will be the facilitator for this discussion. So we're going to start off with a land acknowledgement, which I'll start off by reading off here. So I'd like to acknowledge the land on which Ryerson University and York University stand. It is the traditional territory of the Anishinaabe Nation, the Haudenosaunee Confederacy, the Huron-Wendat, and the Métis. I acknowledge the current treaty holders of this land and the Mississaugas of the Credit First Nation. This territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. Often during this pandemic, we hear that these are unprecedented times, but we fail to acknowledge that these times are extremely familiar to Indigenous communities across Turtle Island. Pandemics have been used as a weapon against Indigenous communities since colonization began. From blankets infected with smallpox to the government sending body bags instead of pandemic test kits to Indigenous communities, this is a well-used tactic. Colonization is ongoing, and it is important to reflect on the systems that continue to uphold it. I encourage you all to look up the caretakers of the land that you're on and any treaties that the land is subject to, whether it is unceded land and so forth. So folks, I just want to highlight the importance of being able to do a land acknowledgement, but also recognizing that it is very much just a very small step that we can do to work towards decolonization. And acknowledging the very fact that we stand on ancestral land now, land that we must preserve, protect, and recognize the Indigenous peoples as the original caretakers. Yeah, so getting into the actual panel, the way that this is going to work is that we are going to start off with a first section where we have questions for our speakers. Thereafter, we're going to invite people from our listeners who are watching. So you folks can type in either whether you're watching through Facebook, whether you're watching through any other medium, and we'll try and pick up the questions and ask our panelists as we go along. Just to give our speakers and everyone else a heads up, I'm just, in the interest of time, going to let folks know when we're at 3 minutes and when we're at 5 minutes, just so that everyone has enough time during the panel to speak and answer the questions. All right, and before we head into the panelists, I'd just like to recognize the collaborators and the organizers for the event. So the panel is organized and co-sponsored by the Continuing Education Students Association of Ryerson, representing over 16,000 continuing education and part-time students, the York Federation of Students, representing over 50,000 undergraduate students at York, the Canadian Federation of Students, representing 350,000 students in Ontario and 500,000 nationally, Unifor, the Ryerson Students' Union, Rye Pride, the Trans Collective, the Jack Layton Chair of Ryerson University, and Capital Pride. All right, so I'm going to get into introducing our wonderful speakers, and then we can jump into the questions. So first off is Kai Reese. They are a member of Unifor 2002 Air Canada. They are a white settler, mad social scientist, witch and homesteader in Newfoundland and Labrador. They have been an activist for 15 years, including with Canadian Blood Services for all three LGBTQ and patient stakeholder meetings during 2011-2012. When they're working, reading, or beekeeping, they're plotting the revolution. And that's Kai there waving. Next up, we have Christopher Carras, principal at Carras Legal Services Professional Corporation, is a licensed paralegal of the Law Society of Upper Canada and mediator. He mainly focuses on provincial and federal human rights matters. Carras is the current litigant in the federal case of Christopher Carras v. Canadian Blood Services and Health Canada. He is challenging the MSM, Men Who Have Sex with Men, blood deferral policy at the Canadian Human Rights Commission to change Canada's blood policy. He challenged the policy when he was barred from donating life-saving blood at a local clinic. The federal legal challenge was accepted September 3rd, 2016, and could result in significant policy changes. The Canadian Human Rights Commission deferred the matter to the Federal Human Rights Tribunal on September 25th, 2019. Carras may be heard at the Canadian Human Rights Tribunal. And Christopher there was waving as well. And last and certainly not least is Omishore Dryden, lives and works in Chibuktuk, Halifax, the site of the oldest Black communities in Canada, current home of African Nova Scotians. Dr. Dryden is a Black queer femme whose scholarship focuses on the lives of Black people and addresses the health inequities we continue to fight against. Dr. Dryden is the James R. Johnston Chair in Black Canadian Studies, Faculty of Medicine and Associate Professor, Community Health and Epidemiology at Dalhousie University. Dr. Dryden is an Associate Scientist with the Maritime Spore Support Unite, MSSU, and a current member of the International Black Feminist Health Science Studies Collective based at Northeastern University. Dr. Dryden is an interdisciplinary scholar who examines the symbolics of blood and the social life of blood donation while engaging with Black queer diasporic analytics and health and medical humanities. Dr. Dryden is the principal investigator of #GotBloodToGive / #DuSang-A-Donner, a research project which seeks to identify the barriers African, Black, gay, bisexual, and trans men encounter with donating blood, and also analyzes how anti-Black racism, colonialism, and sexual exceptionalism shapes the blood system in Canada. And Omishore there was also saying hello to everyone. Perfect. Now that I have taken up way too much time, I am going to start off by asking some questions from our panelists to get this started. Christopher, we're actually going to start with you. And we'll start with a pretty straightforward question. What is the MSM Blood Ban?
So the MSM Blood Ban is a discriminatory policy that bars men who have sex with men and women who have sex with men who've had sex with other men. But this policy also has been used to bar trans women and trans people generally, as well as non-binary folks. These policies are also rooted in anti-Black racism and is just generally a bad policy. It was first introduced in the 1980s at the time when Canada was experiencing the blood crisis, for which the Canadian Red Cross had infected many Canadians, and there were people who had died, who were infected with Hep C and HIV, and so on. And this was caused in part because the Canadian Red Cross had actually purchased blood from an Arkansas prison in the United States, and it made the exchange in Canada and relabeled it Canadian blood. And so one of the ways the government was able to defend itself, and the Canadian Red Cross as well, was to scapegoat, to point the finger at us. And so that is how this policy was introduced and remains to this day. And we're working very hard to challenge this policy to see the elimination of this. But there are still other policies that also be challenged and eliminated.
Thank you, Chris. So I guess my second question on that, obviously leading into it, is in 2016, you challenged the Canadian Blood Services policy after they refused to allow you to donate blood. So where does your legal case stand now, and what do you envision for it?
Yeah, so in 2016, we filed a federal lawsuit against both Canadian Blood Services and Health Canada to challenge the MSM blood donation policy. And it now stands at the Canadian Rights Tribunal. It was actually referred to the tribunal through the Canadian Human Rights Commission. And actually, recently we've received a decision from the tribunal, but we're still moving through that process to obtain the final decision on the matter, so that these policies are eliminated, and that we have a system that is inclusive for all people.
Absolutely, absolutely. Thank you for that. My next question is actually going to go over to Dr. Dryden. So I think we're going to start off here. Hi. We're going to start off with why is blood donation eligibility determined by methods that are based upon sexual orientation? And how does fundamentally that policy promote stigma?
Right. So I just wanted to acknowledge, before I get into that question, that I work and live in Chibuktuk in Halifax, the traditional unceded territory of the Maliseet, whose ancestors, along with the Mi'kmaq and Passamaquoddy nations, signed peace and friendship treaties with the British Crown in the 1700s, which was around 140 years before the end of slavery in Canada. And so I want us to remember that many treaties and a number of treaties were signed while Black people were still enslaved. And so actually not all people are treaty people. And it's also important, especially in a place like Nova Scotia, to understand the long-standing Black communities that are here. So Halifax was imposed upon Chibuktuk in 1749, and it was enslaved African people who were used to dig out the roads and build the city, including much of the citadel. And on the southern shore of the Bedford Basin, it was Mi'kmaq people who shared land with Black people, and this allowed Africville to be founded in the mid-1800s. And so I just want to acknowledge also the indigeneity of African Nova Scotians here in Nova Scotia, and for us to think critically about how to deploy land acknowledgements, and to remember that not all of us are treaty people because of the way that slavery was still vibrantly practiced while some treaties were being signed. And it's also a blood question, because we can't talk about blood donation and blood in the nation without also talking about colonialism, anti-Black racism, and the significant anti-Black racism in the medical field, and the kind of experimentations that were also deployed against Black people and enslaved Black people who did not have agency in terms of agreeing or not agreeing. In terms of blood donation, Canadian Blood Services is profoundly committed, I would argue, to staying situated in racist and homophobic understandings of disease and transmission within vector, and who's a vector and who's a carrier. And there's also this real demonstrated kind of sex phobia that is also not only integrated in the questions, but firmly situated within the decision makers, who would then make the decision about removing sexual identity from the donor questionnaire. So I was at an early Canadian Blood Services meeting in 2000, 2001, when I worked at York University. And at the time, York University was the first university in Canada to bar Canadian Blood Services from donating blood on campus. And so at a recent meeting, I believe it was in 2017, decision makers within Canadian Blood Services suggested that they didn't think it was appropriate to ask a 72-year-old grandmother the last time that she had, unprotected anal intercourse, and then kind of to heed about it in an embarrassed way. And this is what I'm talking about in terms of demonstrating this kind of sex phobia. If in 1998, when Health Canada was creating Canadian Blood Services, one of the responsibilities given to Canadian Blood Services was that they should simultaneously help Canadians become trusting in the donation system, and also educate Canadians in what makes a healthy blood supply. And so if in 1998, Canadian Blood Services decided to actually ask people about their sexual practices, have you had unprotected anal intercourse? Have you had unprotected vaginal intercourse, front hole intercourse, back hole intercourse? How many partners do you have? And then used that time to educate the population in terms of why they were asking those questions, then we wouldn't be where we are right now. And then this idea that somehow Black people and gay people continue to be the cause of AIDS and HIV, that Black people and gay people and Black gay people continue to be those at most risk and those, who will infect the general population. There is a profound way in which I argue that Canadian Blood Services actually doesn't think of us as members of the general public and as members of their community that they would then be treating with respectfully. And whether it's a lifetime ban from 1979 or this faked, in the last 3 months, the sex phobia means that if you're sexually active, you just aren't being a good citizen and therefore you shouldn't donate blood. And if you're sexually active and gay and doing this immoral kind of sex, or, a pervert or a sex worker or trans, or, something that's not considered normal, not considered regular, then somehow there's something wrong with your blood. And we should not stand for that. We should not stand for the whole, sure, plasma is fine, we'll begin with it. We should not stand for that. And these are one of the ways that the stigma around HIV and AIDS continues to be perpetuated, especially when they have questions like, have you ever been tested for HIV/AIDS? As if that's a scientifically sound question, and no kind of sense around the fact that we just came out of the 80s where we're like, y'all need to know your sexual status, y'all need to know your sexual health, get tested. So again, it's this sense of, if you are not only having sex to have babies, then you are having immoral sex and being loose, and that means you can't be a good donor.
Thank you. That was a loaded response. I really appreciate it. And also thank you for clarifying and really honing in the point about treaty holders and who does fall in that and who doesn't, because I think that's a really important point. So thank you for that. My second question for you there. So we talked about the stigma that comes from it. Now let's talk about what the advancements have come since the initial ban. So how has technology advanced the conversation on blood donations? And on that, what type of impact does rapid HIV testing and other screening tools have to address the blood donation shortage, but also support harm reduction in sexual health testing?
Right. Well, you would think that the advancements in technology would actually have an impact on Canadian Blood Services and the donor questionnaire and, who can donate blood and who can't donate blood. So in a meeting I had with, decision makers, in other settings, I call names. But in a meeting I had with decision makers in 2015, what was uncovered at that time was that in 1998, it was assumed that there was a particular strain of HIVO, that was untestable. And it's for this reason why there was a ban on anybody from the entire African continent. And I can get into that more later. Even though a test was made available in 2009, that question stayed on the donor questionnaire until 2015. And it wasn't simply available, it was approved for use. And still, Canadian Blood Services waited 6 years before saying, oh yeah, we don't need to ask this question again, or we don't need to ask this question in that way. And then they changed the question to just speak about Togo and Cameroon. And when asked about that, their scientific justification was, well, if there's a new strain of HIV, then we want to make sure we have enough time to create a test for it. So the assumption is that if there's a new strain of HIV, it would only ever come out of the African continent, as opposed to, I don't know, Young Dundas Square or the Citadel or, Parade Square. So in that same meeting, when we asked about how quickly you could get results on a blood draw HIV test, they were like, you could get that in 5 days. And we said, so if that's the case, then why at that time do you still have a 5-year ban on men who have sex with men? Like, why do you still have that ban? With HIV rapid testing, like point of care tests, there's been yet another question in the 2019 meeting that I attended with Canadian Blood Services, where it's like, is there a way that we can use that test so that we actually can move away from identity-based questions? And their response was, well, we don't know how reliable the point of care testing is. Now, the point of care testing is being used widely. It's a 2-minute test that tells you whether you're reactive or non-reactive to HIV. It would then allow you to go to a blood draw. But if you look at the ways in which clinics are structured in Canadian Blood Services, you can see that they had no foresight in terms of structuring the clinics in a way to allow for this kind of testing to happen on site. And it's not the same. I think it's in Italy where you actually have physicians in the clinics that do that kind of testing that include sexual health information, that include understanding that people have sex, that, all of these pieces. And so even the structure in terms of blood donation is different. And so to a point. And so that allows, I would say, for more viable blood donors and blood offerings, blood products. And so people will say it went from 1979 for forever. It went to 5 years. It went to 12 months. It went to 3 months. And they think that this linear decrease is actually a measurement of progress. And I would argue that it's not. I would argue, I don't think it's feasible or a proper request to say to anybody, don't have sex for 3 months by choice, right? Like many of us do and don't for a variety of reasons, but don't have sex for 3 months just so you can donate blood, right? I think that kind of state pressure on queer and trans communities, African and Black queer and trans communities, is unacceptable. It's absolutely unacceptable. And it's a form of state homophobia and transphobia. And so much so that if you're a man who's had sex with another man and you've not had sex for 3 months, you can donate blood. But if you're a woman who's had sex with a man who's had sex with another man, so say you're dating this guy now, and you keep having sex with him, but he has had sex with another man, you can't donate blood, even though he may have not had sex with another man for 3 or 6 months, right? And so we see these contradictions in the donor questionnaire, and we're working with a blood system that is okay with those contradictions, is okay with continuing to perpetuate this kind of harm that HIV and AIDS remains in the domain of Black and queer people. And for that reason, Black and queer people need to continue to be identified in ways that are harmful. And that is not how you grow a blood system. And that is not how you become leaders or reliable leaders in sharing effective and appropriate information around HIV and AIDS.
Absolutely. Thank you very much. Okay, so we will move on to our third speaker, Kai. So the way we've structured this, we talked a little bit about what MSM is, how the Canadian Blood Services works, what stigmas around it, how technology has brought us here now. But now we're going to talk a little bit more about the policy side and see exactly the work that has been done towards fighting the obviously instituted homophobia that currently exists and transphobia and racism that currently exists within the Canadian Blood Services, as Dr. Dryden was just saying. So we'll start off with Kai here. Why was the process by which CBS, so Canadian Blood Services, reduced the ban?
Hey, sorry, a bit of a delay on my end there, folks. Well, the process that was outlined was that we first met in Ottawa for separately as an LGBT stakeholders, they called it conference, where we met for 3 days talking about how us as queer, trans, and two-spirit, etc. people felt about this policy, and they got a report compiled together of all the things that was said. After that was done, they then got us together for another separate 3-day conference with the recipient groups or the patient groups. And then we kind of sat in a room and just talked about it from our two separate sides about how we felt about the issues. We had a collaboration there about what we would both be willing to accept, and what we felt was, of course, there was a strong discrimination trend going through our contingency, but there was also some real fear on the behalf of patient groups because of, as Christopher mentioned before, that there was a blood scandal, and they had some very real fears that were life or death for them, or what they felt but like were life or death. From that meeting, that second meeting where we collabed together, there was 5 main takeaways that were discovered, and that's that we needed continuing public education as a strong first prong, continuing communication between our 2 stakeholder groups, and that was delivered by Canadian Blood Services with successive stakeholder presentations in 2017, and I think Dr. Dryden also alluded to one in 2019. I'm not sure if they want to speak to that later. I wasn't part of those successive ones. I had moved on to other things. The third thing that they wanted was a collaboration between our 2 groups to actively work towards a reduction in that ban, to be less about identity and more about behaviors, an active commitment, not just from us, because obviously they had that commitment from LGBTQ folks, but to get that from patient groups as well, that was the ultimate goal. And then fourth is research, the continuing research on what would be necessary, the tech that we alluded to earlier, and the fifth, the surveillance of that data, the continuing surveillance of that data, and the responsibility of CBS to make sure that that surveillance was being done and disseminated, so that way it can feed back into the public education and the collab work that we were doing.
Yeah. Wow, they certainly did not make it easy. But thank you for that. That gives us a lot more insight, I think, on how the process works, and genuinely how inaccessible it is, I think, for a lot of people to try to institute these changes. And so that leads us to our second question. So according to the Canadian Blood Services, donor eligibility undergoes frequent revisions, resulting in changes based on current scientific evidence. But what is missing in terms of scientific evidence is needed to end the blood ban? Like, is it really a question of a lack of evidence, or is it simply an unwillingness to do so based on the evidence?
So the second, what's missing really from this data is that CBS really needs to be more forthright and hold up their end of the bargain and share that surveillance data on the research. And they had promised to bring this down incrementally because they wanted to monitor the positive and negative effects it had on the blood supply. At that initial meeting, when we tried to get it down to 5 years, it was kind of fighting tooth and nail for that, just because there was such incredible fear and uncertainty about how any change would affect the safety of the supply. So we got the 5 years on the commitment that, okay, once you see the data that this will have next to no negative effects and only positive effects, okay, we can go quickly to 1 year, and then 3, and then eventually behavior-based. Hopefully the ideal situation would be that the data would be so convincing that they would go immediately to behavior-based. But as we know, 6 years later, that's not what had happened. We know what's missing is that there's mountains of evidence that behavior-based is the superior one for safety, their own reports that they have compiled. And I do have to give CBS a little bit of props sometimes that they are surprisingly on side with us. It's really unfortunately that there's an immense fear from the patient groups and the recipient groups, and they won't really move forward with any kind of change without the consumers being on board with that, because of the history that we alluded to earlier. But the behavior-based in their own report that they sent out to the patient groups indicate that behavior-based is just safer. It asks more accurate questions. It ensures you're collecting the data that, or the outcomes that you actually want. You're asking people about risky behaviors rather than identity groups that doesn't necessarily correlate to a risky behavior. We really, unfortunately, need to convince the patient groups and the public that what we're advocating for is scientifically sound, because unfortunately there's less than 30 or 40%, I think, as indicated in the report, that say that they don't know the science behind this. And as Dr. Dryden alluded to earlier, there is an incredible race correlation here, because one tactic that's been used is saying that there's, less than 50% of new transmissions are actually by MSM or, gay men. that are the new transmissions for HIV. It actually has an Indigenous or a Black lens, that new transmission, and that is being offloaded. We're offloading the discrimination from queer people onto Black and Indigenous bodies instead. As Dr. Dryden alluded to earlier, it's a perfect, that we're not regarded as part of the public. We're these special interest groups to the side. I know that Nordic data is also something that we're waiting on, because I think it was Denmark, don't quote me on that, that did very quickly switch to just a behavior-based survey. So I'm eager to see why CBS hasn't been more public about how that's going and how that could translate into doing that here.
Thank you. Very, very insightful. Okay, so this brings us to the kind of next section. We have some general questions that we're going to be asking folks, but we're also encouraging folks to submit their own questions in the comment sections, depending on where it is that you're streaming the actual panel. What I'm going to do, however, is start off with a general question, and I'll actually just be piggybacking off of what Kai just finished off with in terms of examples from other countries. So my question, I think, starting off, and I'll leave this open if one of you just wants to put your hand up and start it off, but is talking about what are other countries doing to remove their bans on MSM blood? What was that process look like? And also, when did it happen, if we have that information? Would any of you like to start off by tackling that question? Yeah, absolutely. Dr. Dryden.
So yeah, just a few things. Canadian Blood Services actually only thinks of sound research on this question from predominantly white countries. And so none of the work that Canadian Blood Services has done has worked with comparative models out of any of the 54 countries in Africa or any of the countries throughout the Caribbean region. And so at the meeting, I think it was in 2017, when they had representatives from New Zealand, Australia, England, Germany, Spain, and other countries, they proudly claimed that they had, people from all over the world here at this conference to talk about blood donation. In my work, I specifically look at predominantly African and Black and Caribbean countries to see, and the reason why I do this is because the World Health Organization has decided 5 to 8 years ago that that there needed to be a push on having national blood systems throughout all of the world, and they often cite Canadian Blood Services as a best model to emulate. And it makes my blood run cold when I hear that, because they are so profoundly racist. And I'm going to push a bit here, because even the kind of normative language around gay blood is also profoundly racist, right? Like the kind of work that's happened around gay blood has been at the expense of claiming that Black people and African people are the ones that really should be barred, and that gay people are victims from African AIDS, right? So we need to understand that, in the work that I do, I actually center African, Caribbean, and Black men who have sex with men, cis and trans, in that work. And if I hadn't done that, I don't think we would really understand just the level and depths of anti-Black racism and blood donation, and how that goes to formulate our understanding of the gay blood ban.